There are two main types of over-the-counter medications that you can take to help with insomnia. The first are FDA-approved medications that have been shown to be safe and effective and have a clear dosing. The other are dietary herbs and supplements that aren't as well regulated. So when it comes to the FDA-regulated OTC medications, that's a mouthful, there are two main ingredients you're gonna see. And this may be surprising to you because the sleep section usually is a full aisle of products, but they're all the same thing in a different box. Diphenhydramine, which goes by the brand name Benadryl, or you might see it in ZQuil, which is specific for sleep, and doxylamine, which you'll see often under the brand name of Unisom. These medications are both antihistamines, and they were developed mainly to help with allergy symptoms. But they cross the blood-brain barrier, which means they go into your brain and can work on your brain to exert their effects. A main side effect of both of these medications is they make you drowsy. So that's when they became approved and started being marketed to help you sleep. So there are a few things you should know if you want to take over-the-counter antihistamines to help you sleep. The first is that they work pretty quickly. So they work typically within 15 to 30 minutes of taking them, so you can take them right before bedtime or whenever it is you're trying to go to sleep. They're also fine for occasional use. So if you're having a one-off night where you're having trouble sleeping, it's totally fine to take one of these medications. But they're not meant for long-term or chronic use. The downsides of these antihistamines is they're not appropriate for young children, so 12 and under, or older adults, 65 and over. They have a lot of side effects to consider that make them less safe for these age groups. They're antihistamines, which means they can be really drying. So they can cause dry mouth, dry eyes. They can also cause bladder retention. They can make it harder for you to go to the bathroom. They can also make you pretty dizzy and drowsy. So if you wake up in the middle of the night, you're more likely to fall or have an accident because you can't think as clearly. Because of their effects, they can also make you feel a little drowsy, or what we call a hangover effect, the next day, which can make it difficult for you to go back to your normal daily routine. The last thing that I want to point out when it comes to these medications is that you'll often see them combined with pain or fever medication. A lot of people take these medications to help them sleep, but they're really not meant for just general insomnia. You should only take a combination pain medication and antihistamine if you're in pain, or if you're sick and you have a fever or body aches and pains that are keeping you awake. That's when those combination products really come into play and are appropriate for you to take. Drop the marker. Sorry.
Do you